In October, 18-year-old Nevaeh Crain sought help at 2 different emergency rooms within a span of 12 hours, only to return home each time feeling increasingly unwell. During her first visit, Crain was diagnosed only with strep throat, despite experiencing intense abdominal pain, according to ProPublica. Her story is one of at least 2 maternal deaths tied to Texas's strict abortion laws, following the U.S. Supreme Court's decision to end federal abortion protections. Another woman, 28-year-old Jocelyn Barnica, died in 2021 after suffering a miscarriage. These cases have underscored the growing hesitancy among medical professionals in states with stringent abortion laws. Doctors are increasingly wary of treating pregnant women due to fears of legal repercussions, as Texas law enforces harsh penalties, including imprisonment, for actions that could end a fetal heartbeat, even if the pregnancy is unplanned or poses health risks. Medical records indicate that on her second hospital visit, Crain tested positive for sepsis, a severe infection that can be life-threatening. Nevertheless, doctors discharged her after confirming that her 6-month-old fetus still had a heartbeat. On her third hospital visit, Crain was finally admitted to intensive care after an obstetrician ordered 2 ultrasounds to confirm fetal demise. Tragically, she passed away hours later from organ failure. A nurse reported that her lips had turned blue and dusky. Crain would have celebrated her 20th birthday this Friday. While Texas law does allow exceptions for life-threatening situations, the lack of clarity around the law leaves many doctors unsure which treatments may cross legal boundaries, causing delays in essential care for some patients. In abortion-restricted states, patients are often transferred between hospitals as medical teams grapple with the legal implications, wasting valuable time. Pregnant women have essentially become untouchable, said Sarah Rosenbaum, a professor emerita in health law and policy at George Washington University, in an interview with ProPublica. Minnie Timuraju, president of Reproductive Freedom for All, described Crain's death as a stark example of the dangers posed by abortion bans. Pregnancy should not be a death sentence, Timuraju stated, attributing these restrictive laws to Republican politicians such as former President Donald Trump and Texas Senator Ted Cruz, who is facing a re-election challenge from Democrat Colin Allred. "This has to stop," she said, urging people to support candidates like Allred and Vice President Kamala Harris against Trump in the upcoming November 5th election. Timuraju expressed hope that with such backing, we can restore the right to abortion and overturn these bans.